Welcome, everyone. And thank you so much for coming. I'm Katie Gotch, and I'm the coordinator of public affairs for the Association for the Treatment of Sexual Abusers. And I welcome you to our first public engagement event, Understanding Sexual Abuse and Sexual Assault, Causes, Consequences, and Prevention. As you can imagine, some of the topics we'll be discussing today may be a little sensitive, and we do have an individual on site who is available if anyone needs assistance. Angela, would you mind standing? Angela is a doctoral student who is also in a victim advocacy role, so she's available if anyone needs some assistance with that. Just some general housekeeping issues. Restrooms are outside right down the hall. We will not be taking any official breaks. We're just going to kind of flow through the event from speaker to speaker. But there will be the question and answer sessions that will allow people to have some breaks throughout. So we have 4 different topics with 8 wonderful speakers here today. We have a number of resources and materials in the back for you to take. And just a few other housekeeping issues. The question and answer sessions, there will be one speaker who will speak for about 10 minutes. The second speaker will speak for about 10 minutes, and then we'll have 10 minutes allocated for question and answer. If you have a question that you would like to bring up, there are pads of paper and pens at the front on all of the tables. Please write down your question and submit it to either myself or my co-organizer, Kieran McCartan, who I believe is out. I'll introduce him when he comes in. He's just making sure anyone who is interested in coming to the event is currently here. Let me think if there's anything else. Oh yes, you might notice that we have a number of cameras in the room. So in addition to recording this for educational purposes, we also have a documentary film crew here. So if you do not want to be filmed, please try and sit behind the cameras or notify the staff that you are not interested in being filmed. And I think, without further ado, we will get things started with sexual abuse as a public health issue, and Elizabethe Letourneau will be getting us started.
Welcome to our public engagement event. ATSA is absolutely delighted that you are joining with us to discuss the prevention of sexual assault. My name is Elizabethe Letourneau, and I am the president of ATSA, and I am also the director of the Moore Center for the Prevention of Child Sexual Abuse. ATSA's mission is the prevention of sexual assault, and I think we all agree that prevention is the goal. However, in terms of where most of us put our resources, and certainly in terms of where we as a nation put our resources, it's much more after the fact. We focus on criminal justice solutions, and we focus on treating victims. And those will always be critical components of a response to sexual assault, but they are insufficient, and they also wait for people to get harmed. We absolutely must begin to consider how we can address sexual assault before it occurs. We need far more resources and just far more thinking about how do we interrupt this from occurring in the first place. I think part of the problem is that many of us tend to think of sex offenders as unpredictable, unstoppable monsters. And consequently, their actions cannot be prevented. Certainly we know that in the media, that's often the way that this is portrayed, and it's how many of us have really been conditioned to think about sex crimes, that this is something that's committed by someone who's very different from us, and we don't really seem to be able to see prevention. And so I've been giving a lot of thought to how to make prevention real as a goal. Where I'm at Johns Hopkins Bloomberg School of Public Health, prevention underlies everything that we do. And so that is where the child car seat was invented. That is where the use of surgical gloves was pioneered. And that is where all 3 strains of polio were identified and polio best practices were developed. So prevention can look like a car seat, it can look like a pair of gloves, it can look like a vaccine. And I think to most of us, these sound simple and obvious, but none of those prevention interventions were simple or obvious when they were first discovered. And they actually faced opposition. My youngest sibling is 23 years younger than me. So I grew up without car seats, as did my brothers. But my youngest sister grew up with car seats. She's only 25 right now. My mom hated car seats. She absolutely hated them. And it was a real struggle for her to use them all the time. She eventually did. But it's just an example of how something that everyone in this room, you would not think twice about using a car seat. In fact, you would think twice about ever letting a young child or a baby ride in a car without a car seat. It's practically part of our DNA. But there was a struggle to get there. There was a struggle to get surgeons to wear gloves. None of you would let a surgeon operate on you without gloves or operate on someone that you love. And there was a struggle, and there, for some people, continues to be a struggle, but most of us would never risk the crippling effects of polio instead of getting vaccinated or getting our children vaccinated. None of those problems has been eradicated. We still have a car injury and deaths. We still have hospital and surgery-related infections, and we still have polio, but we have made enormous progress in each of those areas. Indisputably, enormous progress in each of those areas. And I really believe we can get there with the prevention of sexual assault as well, if we can all come to agree that each of us is part of the solution, each of us is a preventionist, and see what that means. And so I'm going to give you an example of what I think prevention might look like in the field of sexual assault. My particular area of expertise now is with child sexual assault and the prevention of child sexual assault. And I think one day we may get to a point where effective prevention interventions of child sexual assault look as simple and as obvious as a car seat. More than half of child sexual abuse cases are actually perpetrated by other children, by people who are younger than 18 years of age. And some of those boys and a few girls do that because they're sexually attracted to children. But most of them do it for other reasons. They are hanging out with delinquent peers, they have access to children and are not monitored for long stretches of time, they are impulsive, they lack knowledge about what is okay and what is not okay and with whom. And so I think truly, prevention of child sexual abuse, in particular, may one day look as simple as teaching our boys, our 12 and our 13 and our 14-year-old boys, to not touch the penises of 6-year-olds. And that sounds very simple and obvious, but it is absolutely not being done. We do not teach our children these rules in a way that is overt and that makes sense and that is replicable. And that is one of the places where we need to put some energy. If we want to prevent sexual abuse, we need to look at who's most likely to perpetrate sexual abuse. And 12 and 13 and 14-year-old boys are one of those groups. Another group that has the potential for committing child sexual abuse in particular are the boys who are in fact sexually attracted to children. There are not very many of those boys, but they desperately need our help. And we do not help them. ATSA has a collaborative project ongoing right now to try to develop an intervention to treat boys and the few girls who are sexually attracted to children. Most of these boys understand that they would harm a child if they acted out on those attractions, and they don't want to. So it's a matter of giving them the tools and resources and skills and support to continue to not acting out, to give those tools and resources to their parents, but also to help them develop into healthy, well-supported young adults who are achieving their own great potential. That's just a couple of examples, and they're very different. One is a universal intervention for boys and other kids to avoid abusing children for reasons due to impulsivity or lack of knowledge or other effects. And then the other is really targeted towards boys who are attracted to kids. But that's just two. There's many other ways I think we could develop prevention programs if we put our minds to it and we put our resources to it. But we really don't. We do a lot to try to intervene after the fact. And again, while that's important, it's absolutely insufficient. Sexual assault rates have been declining since the 1990s, and this is great news, and it means we're doing something right, and we need to figure out what that is and package it. I think there's a lot of different avenues for doing so, and that we need the resources for it. So my hope is that if there's one message that you take away from today's public engagement event, it's that sexual assault is not inevitable, it is preventable, and it is something we should all be arguing for resources to go towards. So thank you very much.
I need one more hand. That's two. I'm Bob Geffner. I'm the president of the Institute on Violence, Abuse, and Trauma at Alliant International University here in San Diego, and also the president of the Family Violence and Sexual Assault Institute. And I'm going to follow up on what Elizabeth said, talking not only about prevention, but some of the key issues, and give you some data in the quick time we have. Now, this is not lit up. Does that mean anything? No? Okay. So one of the things we know from the Centers for Disease Control and the research that's been going on is the huge prevalence. Throughout the lifetime, we know that nearly 4 in 10 women, men, girls, and boys either are actually sexually assaulted or sexually abused, or there's an attempt to do that during their lifetime. That's a huge number. We also know that in general communities, out of 80 homes, nearly 20 have intimate partner violence or abuse going on. And one of the questions is, why am I showing that? We're talking about sexual assault. And I'm going to come back and tell you. I'm going to keep you in suspense. Are you all in suspense? 3 of you are in suspense. The rest of you don't care. Okay, be that way. One of the things to follow up is that over 2/3, almost, of sexual assault, sexual abuse that are attempted or completed, as Elizabeth said, are people we know, acquaintances, family members, coaches, ministers, etc. That's a huge number. Now, what makes things even more complicated, and why I put both those statistics up there earlier, was we also know that anywhere from 60 to 75% of couples or partners where there is intimate partner violence, there is also sexual assault, meaning marital rape. Huge numbers. And I put this particular slide up here because here in San Diego we had a precedent a couple years ago that changed the laws. One woman changed the laws in the state of California because her ex-spouse who raped her was convicted of rape, was then given visitation with no conditions upon release of jail. And also she was told that she had to pay his fees. And so she protested, and now in the state of California, you can't do that. You don't get custody if you raped and caused those situations. But the connection between all these forms of interpersonal violence is really big. So when we're talking about sexual assault, sexual abuse, we're actually talking about other things at the same time. This is a great slide. I really like this one. It'd be really good if I remembered who I stole it from. Because it has a lot of the statistics pointed out there. Nearly half of all rapes are even reported to anybody, no disclosure, I don't even mean authorities, to anybody. Only 3% of rapists actually go to jail, and the percentage that are even prosecuted are low. So it's not like we have a really good system of stopping sexual assault. Campus rapes, which we are now, oh good, this died. That lasted a long time. Okay, so much for this idea. We'll go to this one. Plan B, a little smaller. We know that right now campus assaults, sexual assaults, are really being publicized a lot, and that's really a key for what we're paying attention to. We also know that there's a lot of myths around sexual assault. When you actually look at the research, somebody who actually goes to the process of reporting to the police a sexual assault, the chances of it being false are only about 1 in 10, and that's maximum. Now, that doesn't mean that each case isn't that 1 in 10, but it also means that what people think, that it's half of them are false or fabricated, has never been the case. We also, as I just mentioned, well, this one doesn't work. I'm doing really well up here. Does any of them work? Let's try this one. Not much. 31 of the states, the rapist can sue for custody of the kids or visitation. 31 out of 50. And you heard the last election where a physician who was running for office said a woman who was raped can't be pregnant. And 32,000 women each year get pregnant from a rape. So the myths out there are really profound. This is an example of a client we worked with who was a victim of child sexual abuse and then later sexually assaulted and raped as an adult. And this gives you some of the dynamics of what we're talking about. This is a drawing she did, and it's called Shame. She felt so worthless, so helpless, no self-esteem, that the light from the window was not even allowed to shine on her face. And that's the level we're talking about. And that explains why you don't get a lot of complaints. Especially as soon as somebody complains or files a complaint, they're going to be the ones attacked. They're going to be put on trial, not necessarily the offender. And if you want any of these slides, if you give me your card, I'll send them to you because I'm going through them sort of quickly. But there's a lot of reasons why people don't file complaints or report sexual assaults. And in our culture right now, and many others, the norm is actually not to report, whether you're on campus, in the public, or in the community. And that really makes things difficult until we change that. I gave you some steps here on prevention that came out of the Prevention Institute some years ago, which is sort of just a summary. And the reason that I like this is if you look at what they're saying we really need to do, from education to promotion of public safety, building partnerships, and changing our policies, that was from a theoretical standpoint. That's how we move toward prevention. But if we're really going to be serious about preventing sexual assault and sexual abuse, then we have to change our norms. We have to get to a spot where it's not acceptable in any community to have somebody sexually abused, and where the community really gets together. Right now, we have the NFL getting lots of publicity for domestic violence, child abuse, and sexual assaults. Why is the NFL the only one we're targeting? In Mississippi, there's a federal judge who beat up and assaulted his wife. There's not been a call for him to be removed from the bench. And I'm sure in your own communities, you can also think of examples where things have happened. I mean, most people now know about the clergy abuse and the scandals throughout this country. But what you may not know is the original reports on these clergy abuse surfaced 25 and 30 years ago by women all over the country. And one of the things they found is not that people came to their support. People came to the support of the alleged rapist. And we still see that happening now. But now the evidence has started surfacing 25 years later that these weren't fabricated reports, and that we didn't even touch the tip of the iceberg in sexual assault. And we don't have to just focus on churches and religious organizations. We can focus on schools. We can focus on colleges. We can focus on athletic teams. Because we don't have a norm that has been internalized, like the seat belts, where we just don't do that anymore. Does that say 2 or a 5 or a 10? 2, okay. Wishful thinking on my part. And that's what we're talking about doing. Creating a social justice, public health movement, just like other things, to change the norms. And people say you can't do that. Well, people said not too long ago, you can't talk about women's breasts on TV. They said people aren't going to go through their garbage and sort it out. People said you can't stop an addictive, compulsive behavior like drinking. All those movements that are now part of our norms took less than 20 years to change. And now they're part of our norms. But what affects more of us, more of our family, our communities, than any of those combined is interpersonal violence and abuse. So if you're interested, we're actually doing that. We have a whole national partnership that we help coordinate, and you can see the mission and the vision to change the way this country deals with interpersonal violence. So we do change the norms, that we do look at prevention, and we follow some of the things that I mentioned. And I know in the minute I have left, you're going to all have that memorized. But you can see the key is prevention, educating the public, intervention, advocacy, changing our policies, victims' rights, and really a collaborative, interdisciplinary movement. And I'm glad we have some flyers back there. If you want to know more, talk to me afterwards. But that's what it's going to take, all of you and all of us working together so that over the next 15 or 20 years, which is likely my lifespan, that we see a change. Thank you.
Thank you, Bob, and thanks, Elizabeth. So, hi, I'm Kieran. I helped co-organize this with Katie. At the beginning, we said that if you had any questions, that you would write them down on Post-it notes, and we would go around and collect them. Does any tables have any questions for either Elizabeth or Bob based upon what they've said? Okay, so the first question is, the need for more funding and resources directed at prevention has been made clear, but where could this funding come from? And are proposals being denied funding at the minute?
Right, so the idea of trying to come up with new dollars for research is pretty much a non-starter, at least in the United States right now. There's a cost-benefit approach to prevention. Each instance of child abuse and neglect, regardless of what kind of child abuse or neglect it was, is estimated to cost about $210,000 across the lifespan of that child. From victim costs to increased risk for re-victimization to increased risk for perpetration of harm later down the line, reduced educational outcomes, reduced employment outcomes, and so on. So there is an economic argument that politicians on both sides of the aisle in the United States acknowledge, but benefiting from prevention in the long term is a hard sell when we have people really focused on the short term. And it's also a hard sell because we have victims we can see, we have offenders we can see. There's very strong arguments for putting resources into services, obviously, and into criminal justice interventions, and you can't see prevention, which is one of my points. And so that really makes it difficult to get funding. Resources, proposals are being denied. There's not an organization that is funding the prevention of sexual assault. The Center for Disease Control and Prevention, the CDC in the United States, is charged with funding prevention, and they certainly do to the extent that they are able. But by and large, they are not given funds to prevent sexual abuse. They get funds to prevent other kinds of violence. We have effective physical abuse prevention programs. We have effective anti-bullying prevention programs. These are effective in the sense of they've been tried and tested in randomized controlled trials and other rigorous evaluations. We have prevention for shaken baby syndrome. We have prevention for adolescent suicide. We have prevention efforts, successful prevention efforts in several areas of violence prevention, but we do not have it for sexual assault. And so we do need those resources. We need the CDC or the NIH, someone to take ownership of really driving the prevention science, but they can't do that without the resources from government and from other foundations and non-governmental organizations.
Thank you. Is there, well, I think we've got time for one more question of any other table. Oh, that's it. How do we change social norms around an experience that relies on secrets and silence to perpetrate?
She gives me that one. I think it's going to take time, but you start breaking the secret. That means people start talking about it. Start talking about it to your neighbors, to your family members, to your kids. All this thrives in secrecy, and that's where you get the shame from. When we start openly talking about it, even like now, but to friends and others about sexual assault, interpersonal violence, and how that causes significant trauma and what we can do about it, it starts making it more of a norm to be able to disclose. And the other thing that Elizabeth said earlier, and there's some flyers back there by others, is what we call bystander intervention. It's our responsibility to do that, to look at intervening and saying something when we see it happening. The secrecy is what keeps it going. And that's really been a problem, like in campus rapes and sexual assault. So right now, the way we're changing part of it is lawsuits. As you may hear, you know, there's lawsuits against the clergy, the churches, now lawsuits against universities, is forcing them to change their policies so that they don't cover it up, and you, in fact, have to have procedures in effect. So those are all starts. As we change the laws, you change attitudes, and you start in the early grades. We start at the elementary school and preschool, and that's how norms change. That's sort of a simple answer for a complex problem.
And I would just add that what we've been doing for the last 25 years is working. So we have about a 50 or 60% reduction in the rates of sexual assault since 1990. And we should all be rejoicing about that reduction. To continue that decline, we need to bring something new to the table. And I think that new thing is really going to be a focus on prevention. But in addition to declining sexual assault rates, we have had increasing reporting rates. And so I think reporting laws, mandatory reporting laws, are part of that. I think feminist movements that brought rape out of the shadows and quickly on the heels of that brought sexual assault of children out of the shadows is part of that. I think the criminal justice solutions that we developed years ago is also part of that. So there is good news to be heralded, but certainly far too many sexual assaults go unreported, and we could do a better job of that. But it is important for you to know the wins. We have had declining rates of abuse and increasing rates of reporting. And this is good news, and we need to keep doing more of what we're doing. I think we need to better understand what it is that we do that works. Thank you.
So thank you, Bob, and thank you, Elizabeth. We'll have some time at the end for some Q&A. So up next, we're going to move on to the next session, which is about understanding sexual offences. So up first, we have David Prescott, and then following David, we have James Cantor.